Diabetes mellitus, or diabetes or short, is basically a blood glucose problem where the body fails to handle glucose properly. It could be from the fact that the body is no longer producing a chemical called insulin that helps to regulate blood glucose in our body, or insulin might be there, but the body is not even responding to the insulin, and as such, blood sugar or blood glucose accumulates and causes injury to cells and vital organs. And just in related to this story, this is something we see often, and it's a very common complication, a very common problem that comes with diabetes. And usually we start just like the story that was just read. We start as a minor, very small access, maybe a nail prick or something, and progresses to become a very big wound that sometimes requires amputation. So it's important for us to prevent diabetes. It's very important for us to prevent diabetes. It's a preventable disease. It doesn't have a cure. As at now, as we speak, there's no cure for diabetes. But I tell my patients and their relatives, prevention is cheaper, because once diabetes sets in, most when the complications are there, is very expensive to manage, especially with the prevailing economic situation. So prevention, lifestyle, especially if you have a family history of diabetes, have someone in your family that has diabetes, your mom, your dad, your sibling, you have to be careful what you eat, how you eat it, and when you eat. Okay, so prevention, lifestyle, avoiding activity, mind what you eat, and at what time you eat what you eat. So it's very important, prevention. Okay, because diabetes can affect not just the leg in this case. It can affect the eyes, it can affect the kidneys, it can affect different organs of the body. Okay, so it's something that can be prevented. I have a patient that have had diabetes over 50 years and no injury on her leg. She can still walk. I have another patient that's 90 something. She has had diabetes far less than the other patient. I think about 20 something years, but she could still drive. She's 90 something years. She could still drive. So diabetes is a condition that, if well managed, you can live with it and don't have complications. It only becomes a problem when the blood sugar is poorly